Very good afternoon, and thank you, AIOS, for letting us present our work on orbital lymphoma. This is a retrospective analysis of a large case series from a single center in South India. Yeah. As we all know that lymphoproliferative lesions are common diseases of the orbit, with 67 to 90% of them being an orbital lymphoma, making it the most frequent and the common neoplasm malignant in the orbit in the adults, with the most common cell of origin being a B cell, and rarely from T cells or the NK cells. So it was a retrospective consecutive interventional case series analysis of over 20 years involving 171 biopsy-proven lymphoma cases, where our aim was to analyze the clinical profile, the clinical radiological correlation, and a protocol-based management approach to these cases. As we all know that lymphoma has an insidious onset, as it is described in most of the literature works. In our series, we had about 80% of them presenting, but to our surprise, about 12% also had features of an acute onset. In our series, what we observed was that there was a lower age at presentation, about 50 years. As we all know, the literature points that about the disease belongs to the 6th to 8th decade of life, and like non-ophthalmic extranodal lymphomas, in our series we found a slightly higher male preponderance. How did they present to us? One is the prominence of proptosis in about 62% of the cases, then a mass in about 50% of the cases, acute features of pain in 20%, a reduction in the vision in about 20%, ptosis in 11% of cases, and a double vision in 6% with quite overlapping features in between them. Following the protrusion, the most common symptom was again a mass, and on our evaluation, about 75% of our cases had a mass which was palpable and was confined to the superior temporal quadrant of the orbit in 65% of the cases. Following this, we also noted involvement of the ocular muscles involving the superior rectus LPS complex and the lateral rectus, with the elevation deficit noted in about 60% of our cases. And as a part of the spectrum of lymphomas involving the mucosa associated lymphoid tissues, about 26 percentile showed involvement of the lacrimal gland. This is a CT image of the same, and the conjunctiva was involved in about 23% of our cases. Radiological evaluation and correlation showed non-specific features. However, what was interesting to note that there was a breach of the orbital margin with contiguous involvement of the paranasal sinuses in about 14% of the cases, and also an intracranial extension noted in about 8% of our cases. There was a 44% correlation between our preoperative clinical diagnosis and the histopathology. Depending on the clinical spectrum, those which were completely resectable underwent an excision biopsy, while the tumors which had a more diffuse involvement underwent a multi-level incision biopsy, highlighting the importance that the biopsy is taken from the epicenter of the lesion. What it showed on histopathology and immunochemistry and cytoanalysis, that primarily we had B cell and T cell, with the majority of them being B cell lymphomas, of which the most common was the extranodal marginal zone lymphoma, followed by follicular, followed by diffuse large B cell lymphoma, and then the mantle cell lymphoma. This shows the extranodal marginal zone lymphoma with small to moderate sheet of lymphocytes. Next in common was the follicular lymphoma. It is interesting to note and to learn that follicles, though may be seen on histopathology, what really confirms and differentiates this from benign reactive lymphoid hyperplasia is that ensuring that the sampling is correct, and second is that it shows expressivity of the BCL2 protein. A mantle cell lymphoma shows positivity towards the cyclin D1 and CD5 cluster differentiation 5 expression. And a diffuse large B cell lymphomas, they are associated with the poor prognosis, and those particularly with a high Ki-6-7 index. A few of the cases were T cell lymphomas in our series, and we have the longest follow-up for our case to be about 8.5 years, and the arms of management include radiation and chemotherapy, with about 87.5% showing alive and well on follow-up. Here are a few examples of pre and post cases of lymphoma. Thank you.
So, what was you said that the 4.4% odd had recurrence?
Recurrence, yeah.
At what duration after treatment did they have recurrence?
4.5 months is what we have seen in our series.
Okay, and this is 4.5 months after the completion of treatment.
Yes.
So that would probably mean inadequate treatment rather than a recurrence, because I mean radiation is itself spread out and chemotherapy is spread out so much.
I would partially agree to that, but I would have to always go back and look up.
Look at the data.
Yeah.
How long of a period? You have a large sample size. How many years was
This is over 20 years.
Okay. And I'll ask the same question I asked the previous speaker, but did you see any change over time? Or you haven't looked at that, whether
Yes,
lymphomas have become more common?
Yes, I take a leaf out of Shafali's presentation where Dr. Akshay had suggested that we classified 10 years and 10 years to look
Right.
at the differentiation. We should do that. Yeah.
The other, you had several cases that were bilateral involvement in the orbit?
We had unilateral involvement in about 90% of the cases.
And the 10% had bilateral?
Bilateral, yeah.
Did you do a systemic workup for all these patients?
Yes, sir. We do.
And what was the percentage? How many had other sites involved?
Yeah, 4% of the 4.9% of the cases had systemic involvement as well.
Thank you.
Thank you.